I tell them to keep living because no one's going to go before their time. So whatever you want to do, keep doing it as long as it's legal. Try to live the best life you can. Try not to look at the shoulda, woulda, coulda. I tell patients, don't blame yourself. Don't think you caused this. Don't worry about what happened yesterday. Take today and go forward.
Yes, I think you have the hope because with knowledge is power. And today, this is where you're starting, or hopefully, this is the beginning, middle, but it's certainly not the end of your journey with being empowered. And so, I think you have hope knowing that you have the knowledge of what's going on, what the risk factors are, how to diagnose, what the treatment options are available. You know, you won't be specialists by the end of this talk, but you have enough to have those conversations. And I think that's very powerful. So, that should give you hope to go out, ask the question that you need of your doctor to get screened. And not just for you, but more importantly, I hope that you will feel empowered to share this with your friends and family and other people, especially in the African American community, since we're so disproportionately affected by liver diseases that I've mentioned, as well as liver cancer. So I think the hope is in the knowledge and the power that you've gotten here today, but that you can also build upon what we've talked about and then take that into the communities where we live.
Well, when someone comes in to see their physician, we always do a CBC, which mentions the white count, the red count, platelet count. And then we do something called a chemistry panel that shows electrolytes, sodium, potassium, glucose, and their liver function tests. One called the alkaline phosphatase, the ALT, the AST, and the bilirubin. Those are the four we always check. If those are abnormal, then we may do further imaging studies, a CT scan or ultrasound. If we see a mass and we get a biopsy, then we'll look at the type of cancers. If someone has a liver mass, then we may do something called an alpha fetoprotein or AFP. If that's very high, that could mean liver cancer. There isn't one particular. The only way to say this is liver cancer is with a biopsy. Cancer is a team sport. There are many people who are involved in the care of a liver cancer patient. First of all, this patient's primary care doctor will probably see the patient first, order the tests to get things rolling. Once you have a diagnosis, then the patient will be referred to a medical oncologist. So a medical oncologist is a physician like me who is trained in internal medicine and then oncology. And we use things like chemotherapy, immunotherapy, targeted agents, and we manage cancer patients. Some patients may need a radiation oncologist, and usually the medical oncologist will refer the patient to the radiation oncologist if the patient needs radiation for the liver cancer. There's another specialty called interventional radiology. Those are the physicians who may do what I mentioned, the chemoembolization or the radiofrequency ablation, where they do the local treatments. And then if someone is a candidate for surgery, they will see a surgical oncologist. Usually the surgeons are more specialized. For instance, someone who does liver cancer surgery will be a liver cancer specialist or a GI surgeon. So there are many different physicians and specialties that go along with the care of the cancer patient, particularly the liver cancer patient. I do not recommend those because vitamins and supplements are not foods and they're not drugs. So they're not regulated by anybody and really don't know what's in them. We also don't know what kind of reaction certain supplements may have with the chemotherapy. For instance, I usually use one example is radiation therapy causes something called free radicals. That's how radiation fights a cancer. If you take certain high dose vitamins, it binds up free radicals, which may make the treatment less effective on a cellular level. So I have a patient who is undergoing cancer treatment. I'd say you can try like one multivitamin per day, but don't take a bunch of extra vitamins and supplements unless your physician specifically tells you to do it.
Okay.